guys, welcome back to Giant Clinicals. Today we're going to start with the first aid, and the very first system that we're going to be conducting would be and studying would be endocrine. So we're going to be starting with the basic embryology. So the very first gland that we're discussing is thyroid. So thyroid basically develops from the floor of primitive pharynx, and this is how the primitive pharynx looks like. Thyroid is endodermal in nature, that's what you need to know. It descends into neck, and it is the first gland that actually develops. So it is connected to the base of the tongue. So this is the base of the tongue where it's basically connected with the help of thyroglossal duct. Okay, so this thyroglossal duct eventually ovulates, but if it doesn't, it is going to persist, and that's what we're going to discuss later on. Eventually, when it basically ovulates, there's foramen cecum, which is found at the junction of anterior 2/3 and posterior 1/3. So this is the point where thyroglossal duct is present, and it basically then descends from the base of the tongue to the anterior part of the neck. It may persist as cyst or pyramidal lobe. So there are two things that how it's going to be persisting. One is the cyst, thyroglossal cyst, and the second one being the pyramidal lobe. Foramen cecum is the normal remnant of the thyroglossal duct. Most common is ectopic thyroid tissue, which is present in the lingual thyroid. So what happens is that on the base of the thyroid, there's going to be lingual thyroid tissue, which is considered as ectopic source. So normally what happens is people actually get it removed. So now this is going to be removed. The person that might be the only source of thyroid in that body. So if this is going to be removed, the person is going to have the sign and symptom of hypothyroidism. Ignore the spellings, please. Sorry. So thyroglossal duct cyst presents as an anterior midline neck mass, which is going to move with the swelling or the protrusion of the tongue, whereas the persistent cervical sinus leading to the pharyngeal cleft cyst in the lateral neck. So there are two types of masses. One is going to be found in the midline, and the other one is going to be found on the lateral aspect of the neck. So I'm just going to show this as the lateral aspect of the neck. This is the lateral and this is the anterior aspect. So if you see a mass, you're going to simply ask the patient to move their tongue. With the movement of tongue, it can actually move upward. So if there is movement with the tongue, that is basically thyroglossal cyst. And on the lateral aspect of the neck, you're going to be seeing a mass, which is going to be what? Pharyngeal cleft cyst. That is associated with the second cleft. Thyroid follicular cells are derived from the endodermal cells and parafollicular cells. So thyroid has two types of cells. Thyroid cells actually have two types of cells, which is going to be follicular and parafollicular. Folliculars are endodermal in nature, and parafollicular are basically derived from the fourth pharyngeal pouch, ultimobranchial body. Initially, it was considered as neural crest cells, but not anymore. It is fourth pharyngeal pouch, and the follicular cells are basically derived from the endoderm. Now we're going to be discussing about the pituitary gland. Actually, we're going to discuss this in the next video. Thank you so much, guys, for joining in.